News Talk 640 WFNC. The face you see on screen right now, if you're following on Facebook or our YouTube channel, is that of Tamra Morris. You are the Deputy Health Director for the Cumberland County Department of Public Health. How are you today?
I'm well. How are you?
That's good. You guys are following in the footsteps, excuse me, of Dr. Jennifer Green, who would come out here and let the folks know what's going on in terms of keeping themselves safe and healthy.
Yeah.
What do you got on tap you would like to chat about?
Yeah, so I definitely want to announce tomorrow's Awareness Day. So tomorrow is National Vaccination Day, which directly aligns with what I know you've heard her talk about on the station before, our immunizations clinic and our availability for vaccines. Definitely pushing MMR currently. Measles is a problem across the state and increasing. We don't have any cases here in Cumberland County currently, thankfully, but we are prepared to respond if need be. And we know that the preventive practice of getting your vaccinations, having that immunity status will definitely protect you, and it's our best defense. So we want to encourage folks to come to the immunizations clinic. It is walk-in available Monday through Friday. Some Fridays they have inventory, so they'll be finished at 1. But tomorrow's National Vaccination Day, and so we're hoping folks will come out and get that MMR if they don't already have it.
You know, Tamra, you make a very good point about the immunization because I've been following the outbreak of the measles. Mm-hmm. We started hearing it down South Carolina in this part of the woods, and now it's in North Carolina. And I don't know if it's 80% of the folks, or I don't know if you have a better number than that, who have it, did not get the vaccine, and they involve children.
Yes, so that is about the average currently, what we're seeing. Children who have not been vaccinated, even if they haven't had the first dose and haven't had their second, we can do something about that part. So we definitely want to make sure that parents know that their best line of defense for their young ones is to get both series. And then if you're an adult and you haven't had it yourself, you can also get the MMR vaccine. So pregnant women are at a higher risk of being if they're exposed and contracting the illness. And so we want to make sure that we're providing that information early.
Talk about the symptoms because it's more than just a rash.
Yeah. So the rash is probably the most prominent symptom that folks are familiar with. There could be other symptoms that mimic another respiratory illness. So a fever or, things that you would see with the flu. And so if you're not quite sure, the biggest message that I want to have for you all is to make sure that you call us first. Call us or your provider. Don't visit the office initially. Call first because there are some protocols that we need to put into place if we need to bring you in for testing prior to coming into the lobby.
You're making a good point because measles, highly contagious. Talk about how it's transmitted.
Yeah, so it's airborne. So if you were to think, oh my goodness, I was around someone, I was at one of those locations in another city where they said that someone who had been exposed or that was a positive case. And so now I feel like I'm seeing some symptoms. I want to come in and get seen. If you come into the lobby, and then you go to registration, and then you go to our clinical areas, you've now exposed everyone in that area. That contact tracing of us having to reach out to all of those people, make sure that all the surfaces have been cleaned, quarantine individuals if it reaches that point, if there's a positive case, that is very strenuous and requires a lot of manpower. And so even if it's just a little bit of time that you're in that area, you could have still passed it along because it's airborne.
What's the incubation time frame?
Yeah, so if you have to quarantine for or isolate for measles, it's 21 days. And so that is a long time, yeah. And so we don't want anyone to be away from their family members or their job or school for that amount of time when we could have prevented it, number one, through vaccination or tested and treated and appropriately cared for you as an individual, as opposed to putting so many others at risk.
If you're just joining us right now at 8:30 here at Good Morning Fayetteville, we have Tamra Morris, who is the Deputy Health Director for Cumberland County Health Department. And we all miss Dr. Green. I guess you guys miss her
We
as well.
do. Big shoes to fill. I could never fill them. Thankfully, our county was gracious enough to allow her to work with us on some projects, consulting. So some of our strategic planning and accreditation benchmarks that we're in the planning phases for our site visits for next year. She's providing some expertise, but she's in quite a different time zone. So it's interesting navigating the time difference, but she's trained us well. She's definitely a wonderful teacher and leader, and so we're just carrying on with the practices that she put in place while she was here.
We're talking about immunizations right now, and I know the sports and rec division here in Cumberland County getting ready to start their
Yes.
whole thing with spring sports. You had got to get some health checks in for the athletes. Do they go to the health department or the private doctors? What do you provide?
Yeah, so the option is there either way. You can go to your child's pediatrician if you see us for primary child care. So our child health clinic does see kids for sick visits and well visits. They can provide those physicals as well. You can get those done at the health department as well. So we're at 1235 Ramsey Street. If you need to make an appointment, you can give us a call. That's 910-433-3600, and someone can get you scheduled in the child health clinic for a physical.
All right. What else do you have going on here that we need to know? You got a little list there of stuff you want to make sure. I want to make sure you get your time in here.
I do. So I just wanted to make sure that we share a couple of our upcoming outreach events. Our Cumberland Fayetteville Opioid Response Team. That team opened a recovery resource center last year, the year before, and so we are coming up on our annual resource day. So their outreach event will be at the Recovery Resource Center, which is on Executive Place, 707 Executive Place. And so that will be an opportunity for folks in the recovery community, individuals who are providing services, whether that be holistic or clinical, to provide some information to those individuals, and anyone seeking support or awareness or information would be able to come to that as well.
We had that team out here, and we talked with them about the extensive work that they're doing in the community. It's important work, and to have the resources to bring somebody back, for example.
Yes.
And we have the medication to do that. What are those things called? The things that you
Narcan, yeah.
Narcan, right.
So there'll definitely be Narcan available at this event. We also have it available through our training and available resources through our department. So if that's something that you need, you can reach out and call us as well. Another event that we're having that's a little bit more family oriented is our second annual Autism Resource Fair. So I'll tell you about two things at once. So we typically have in the spring and maybe a fall session for Vax Yourself, Vax Your Pet. That's our event where you can get your furry friends vaccinated, and you can also come in and see our immunizations clinic for any vaccines that you may need: COVID, flu, measles with that MMR. There'll also be our STD Express clinic open that day. So we'll also host that on April 18th, typically as we would in the spring. But also on the 18th will be our second annual Autism Resource Fair. So that will be from 10 to 2 at our building. That is in service and recognition and awareness and support for those families with children with autism. So what makes you different makes you beautiful, and we want to make sure that we're providing them with services and resources from local community groups to support their families.
There's an awful lot going on at the health department all the time. It's a good resource. And I think within the facility itself, do you have an information booth or someone who can kind of give you if you don't know where they need to go? Talk about that a little bit, because if you're lost about this, you don't know if you qualify for benefits and all that, what should a person do?
Yeah, we don't want anyone to be lost. And so coming into our building, there is an information desk. And so Miss Wanda sits at our information desk, and she's very knowledgeable and can point you in the right direction. But we also have our agency brochure. So if you just want a printed information, something to take with you that kind of describes our programs and services, we can provide you with that. Or you can visit our website. So cumberlandcountync.gov/health will take you to the public health page. All of our tabs have robust information about our programs, our clinical services, our outreach events, how to get in touch with us and request for us to come out and either teach a class or provide an tabling and information and resources for a health fair or for a local church. So whatever it is that you may need, we probably have some information to be able to at least point you in the right direction. And we're not the end all be all. We don't know all the things. We aren't the 100% services. We're not a mental health provider, but we connect you to the people who are. And
the neat thing about your location right there on Ramsey Street, you're right next to the Department of Social Services.
Right there, shared campus.
Yeah, so you guys can work hand in hand.
Yep.
Tamra, we appreciate you coming out. You guys come out once a month now?
Yes.
For the first Thursday?
First Thursday,
First Thursday. So we appreciate you coming out, sharing information. If all of a sudden you have something that you really need to get out, give me a call. We can slip you in and you know, other than just the first Thursday. But we love having you come out, and we know for sure at least that once a month we can get that information.
Sounds good. Thank you so much.
All right, you're listening to News Talk 640 WFNC. Right now, local news from CBS 17.
Good morning. From the CBS 17 newsroom, I'm Bill Young. A Fort Bragg soldier is accused of shooting and killing his uncle. Investigators in Tennessee say Jacob Stinnett killed his uncle on Christmas Eve. Authorities arrested him last month and charged him with second-degree murder. A Fort Bragg spokesperson said they are working with authorities. The attacks on Iran continue to impact fuel prices here at home. The national average for a gallon of regular is $3.19, roughly